Chris Vining with the CL Medical Group in Cold Lake is joining me today. The group has been up to some big things this year, and I understand that you've got a new set of doctors coming in for the new year. Can you bring me up to date on what's happening?
Yeah, so I've been on city council here in Cold Lake now since 2010. And ever since 2010, every year we do our strategic priority planning. Our healthcare and access to doctors has been number one, number two, as long as I've been on council. So it's been an ongoing thing. We've been lobbying a lot with the province and with Alberta Health Services to have a little better access. In the last number of years, we've kind of hit a bit of a real crisis point in terms of primary care and family doctors and stuff. Like our last community census that we did, that was one of the questions we put on our municipal census. And we found at least 40% of the population in town is without access to a family doctor. So we've really been looking at it that way. So one of the places we've gone, like I said, we've done a lot of lobbying with Alberta Health Services over the time. And it's a little bit challenging because we can lobby for doctors for our community and help them out when they come around. But for Alberta Health Services, they are looking both for family doctors for the community, but also for doctors that are going to work at the medical center, at the health center here in town. So you kind of have doctors going in there, they're split between kind of two worlds, right? They have their clinic time where they can do their family practice, but then they also have their time over in working, doing different ER, surgical assists, those kind of things at the hospital. So part of what we were looking at is how can we help with doing more clinic type stuff and kind of seeing if there was a way we could kind of think outside the box a little bit and do a little bit more and help a little bit more with recruiting. So just happened to be that there was an opportunity. There was a clinic in town that a couple of doctors had built and owned in town with a pharmacy attached. And those doctors were preparing to another opportunity to leave town. So we decided as a city to approach them to talk about purchasing that clinic off of them, then creating a municipally controlled corporation, which is what we've done now. So we are now in possession of the clinic. And we started out with 2 doctors in the clinic. We're now up to 4. One of which is a dedicated family practitioner. That's all that particular doctor does. So more access to hours in that sense. And we are now kind of carrying on that recruiting so that when doctors come to town, that they have come through AHS recruiting, we are now showing them our clinic and our clinic space to help them out, because we are also very tight within the city for clinic space. Most of our doctors have their practices in the hospital on the 2nd floor, but they're basically running out of space there, and AHS is kind of having to squeeze down a little bit more, just doing to additional services. So we are trying to help those doctors with clinic space, and then they come in and basically rent from us. So they're their own independent contractor type of thing, and then they pay lease to us for those kind of backbone services, right? The building, the people who do the billing and chart work and all those kind of things for them. So yeah, that's where we're at right now. And so it allows us a little bit more. So now if we know that there's doctors out there that just want to do family practice and really don't need hospital privileges, don't want to be doing surgical assistant ER, we now have a spot like to say, yep, good deal. Like we like that. Let's talk about it. Let's see what you can bring, and let's see if we can find you clinic space with us. And we've been getting enough interest with the clinic and that we are now as a board moving forward with doing some investigating around expansion. What more could we be doing? We've tried to engage with some other different types of providers too, to see if, if we expand, is there the opportunity to create a little more well-rounded kind of campus of care type of thing. But yeah, like we are very much kind of taking the training wheels off and seeing where we can take this. Like, we know that in Cold Lake we've had some very good success with nurse practitioners. So the new model that the province has come out with, that's got interest from us. Like, is that a possibility for us to recruit some nurse practitioners into our clinic to, again, just to try to expand that availability of primary care to residents of Cold Lake.
I'm sure the people of Cold Lake will be happy to hear that they're going to have some new doctors in the community. It looks like a city that is just going to be growing. So what's next for the corporation and for Cold Lake?
We do see big economic gains coming to our area and to our community. But with that is going to come, more young families. And we are already a very, very young population in Cold Lake. And that is just going to get, it's just going to, we think that it's going to continue to accelerate and continue to trend that direction.
Well, thank you for joining me today, Chris. I do appreciate your time. Have a Merry Christmas and a Happy New Year.